also a medical doctor. Congressman, bottom line here, is there or is there not a public option? We've been hearing all kinds of differing views as to whether it's included in the president's new plan.
Well, in this new plan, which was just posted this morning, I haven't been able to decipher all of it, but no, there is not a public option. And I'm glad to see that. But what is in there is one more unconstitutional section, which says all of a sudden the federal government can tell the health insurance industry what they can charge in the way of premiums. I mean, you know, they already have that unconstitutional provision to say that every person in the United States is forced to have health insurance whether they want it or not, whether they need it or not. So I think this latest version is certainly not something that I could support, and not something I think that my colleagues in the Republican Party and the American people, they're definitely not going to support this.
What would you like to see in there? I'm not talking about what's in there right now, but what would you like, Representative, to see in there, whether it's tort reform or being able to carry your insurance across state lines, that would get you closer to at least a starting gate?
Well, you mentioned two, absolutely, both of those. But let me just tell you this. I had a call the other day from a former physician member from the state of Georgia, Dr. Roy Rowland, who served 12 years from Middle Georgia, from Dublin, Georgia. And he said, Congressman, tell President Obama that in 1994, in a bipartisan way, we presented a bill to committee, the Health Care Reform Act, the Bipartisan Health Care Reform Act of 1994, co-authored by 5 Democrats in the majority and 5 Republicans. Dr. Rowland, Dr. Greg Gansky on the Republican side, another physician, Jimmy Cooper from Tennessee, a current member,
and
former member Mike Billericay. A couple of the things that you just mentioned, association health plans, buying insurance across state lines, medical liability reform, and this was presented to President Clinton back then. I say to President Obama today, you know, this is deja vu all over again. If you will truly want bipartisan ideas, not just from Republicans, but from conservative Democrats as well, let us come to that meeting on Thursday and with a clean sheet of paper. Don't give us a new and expanded version where you increase to $27,000 the exemption on these Cadillac plans, another handout to the labor unions, and try to tell us that you've got something better. The American people are not stupid, and they're not going to fall for that.
Why does this new plan cost so much money? It costs even more money than the old plan that had the public option in it.
Well, I think if you look at it, again, there's in regard to it's given more in Medicaid help to the governors. They were just in the White House, at the White House, begging. You know, it's kind of funny, the governors from 48 states have a balanced budget amendment, and yet they come to the federal government with hat in hand and say, help us balance our budget, at the same time, let yours go to hell in a handbasket. That's kind of disingenuous, but you know, again, they end up spending more money. I would like to know what the CBO has to say about this new and improved, I think, worse version of health reform.
I'm sure we'll hear from the CBO shortly. Congressman Phil Gingrey,
so.
Thank you very much for coming in. Appreciate you coming.
Thank you.
Well, one California community so desperate for jobs, it's actually sending government officials to school.